Hi everyone, my name is Dr. Shabri Hussoor. I'm a GP with special interest in diabetes, working the southwest of England. I'm also the medical director of Adisha Health. So today is the day 7 of Diabetes Awareness Week, and we're going to talk about diabetes treatment. So, just a little bit of recap. What happens in diabetes is you've got high blood sugar, and this is because the pancreas is not producing enough insulin, or there is insulin resistance, or the body doesn't produce insulin at all. So the treatment obviously depends upon the type of diabetes. There are four main types. The first one is type 1 diabetes, where the body is not producing any insulin at all. And type 2 is the most commonest, and here there is not enough insulin and insulin resistance. The gestational diabetes is the diabetes found in pregnancy, and type 3C is due to the pancreas problems. Now, in every type of diabetes, what we need to remember is you need multidisciplinary team who are looking after you. And this multidisciplinary team might involve the healthcare assistants, nurses, phlebotomists, dietitians, psychologists, opticians, diabetes specialist nurses, GPs with special interest in diabetes, hospital consultants, etc. Broadly, the treatment of every type of diabetes again consists of diet and exercise and medications. Now, let's talk about specific types of diabetes. Coming to the type 2 diabetes, it's diet and exercise, oral anti-diabetes medications, injectable diabetes medications, and insulin are the modalities of treatment. Now, you might ask me, everyone tells me about diet, what do I do? So, if you can follow the Eat Well guide, which is there in this slide, some people might need dietitian's consultation. Please attend the structured diabetes education, and the referral will be done by your practice, because you get a lot of information and that empowers you to work on your diet. Exercise. Again, my patients say, everyone says, do exercise. How much am I supposed to do, doctor? So the prescribed exercise is you need to do 150 minutes of moderate aerobic exercise of 150 minutes in 1 week, which works out to be 30 minutes in for 5 days. It could be brisk walk or cycling or jogging or swimming, etc. You need to do 2 to 3 half-an-hour sessions of resistance exercises. So just to reinforce, 30 minutes 5 days a week of aerobic exercises and 2 to 3 half-an-hour sessions of strengthening exercises. Coming to the oral diabetes medications, a few decades ago it used to be just metformin and sulfonylureas, and the next thing is insulin. However, there are many oral diabetes medications which are used now. It is quite complex. I have just put this slide with the names. Please don't be again overwhelmed with this, because the healthcare professional who is looking after you will look at your blood sugars, the different medications you're already on, your kidney functions, and other medical problems that you suffer from, and make a decision regarding which medication is best for you and support you in the treatment. Coming to the injectable diabetes medications, it's incretin mimetics, and the next one is insulin. Both are used in type 2 diabetes. Coming to the type 1 diabetes, it's mainly diet and exercise, but mainly it is insulin. And now, obviously, they are trialing out islet cell transplant. Now, insulin treatment is very, very complex. It is used in type 1 diabetics definitely, because there is absolute deficiency of insulin, as I've mentioned in my previous video. And it is also used in type 2 diabetics where their blood sugars are not controlled with combination of all the oral diabetes medications. Then you go on to insulin. In the market, there are more than 20 types of insulin. So again, it is quite complex. I do not want to get into it in this video. Again, your healthcare professionals will find out what's the best regimen, taking into consideration your age, renal functions, other medical problems, and the other medications which has been used till now, and then they will support you in choosing the insulin and taking the insulin. Coming to the gestational diabetes, again, mainstay, you still have to have a good diet and active physical life. The only oral diabetes medications that you can take is metformin. Obviously, with these two, if the blood sugars are not very well controlled, then you'll have insulin injections. The good news is if you manage your diabetes well, you can have a very fulfilling personal and professional life. Now, these are the resources for the treatment of diabetes. Listen, the diabetes treatment is a very complex issue, and you will need a lot of support from different specialists to make the right decision. And what I have explained here is really tip of the iceberg, just so that you have a general knowledge about the treatment of diabetes and you can ask the specific questions with your healthcare professionals. I hope you have enjoyed this video and thank you for listening. This is my last video of the 7 videos. Hope you have enjoyed watching this video. I hope you're a bit more aware and you will seek help appropriately. Thank you all.